Hi, this is Dr. Dennis Long, Sports and Regenerative Medicine. Today we're going to talk about tennis players. I had a senior circuit tennis player, and tennis players with shoulder problems are prone to get certain things, and as you get older you're more prone to have arthritis, and the mechanics of an overhead serve puts the shoulder in a compromised position. So let's talk a little bit about shoulders. We have a nice anatomical MRI here and an X-ray. So the shoulder is a ball and socket, much like the hip. The ball is the head of the humerus, which is this. So it should be a nice ball type appearance. And the shoulder has a socket that's just a portion, which is called the glenoid rim here. The rest is not a bony articulation because it's made up of the glenoid labrum and the overlying rotator cuff. And the reason for that is there is much more shoulder motion. As you can see, ball players are way back here, the pitchers, but your hip can only do certain motion, not as exorbitant as a shoulder because it's not limited by a bony articulation. So the overlying rotator cuff is composed of 4 tendons that come together and form the rotator cuff. And they are the supraspinatus, the infraspinatus, subscapularis, and the teres minor. And this MRI shows some of the major muscles, and it's pointing out the anatomic landmarks. When we shoot to this X-ray, you see very clearly, this is the head of humerus, glenoid rim. So this becomes important as you age. There's glenohumeral arthritis, then this becomes narrowed and also arthritic. The other thing that we got to concern ourselves with is the acromion and the clavicle. The acromion is the distal portion of your shoulder blade that comes forward and makes the acromioclavicular joint. So the clavicle is your collarbone, which is here. This is the acromion. This is the acromioclavicular joint is contained by a ligament. So when shoulders are separated for sports injuries like tackle football, and they talk about a shoulder separation, the ligaments are torn and maybe this bone is up here because the ligaments have been damaged. But sometimes it's just a sprain and it isn't moved or separated. The problem is, as we age, a lot of times you get arthritis underneath the AC joint. So the acromion should be nice and flat. This is a dramatic illustration of what happens when you have a giant bone spur. Instead of being flat here, this whole downward circle is a gigantic spur that is actually going to be pinching the supraspinatus. Supraspinatus' job is to initiate abduction, and it's important for external rotation. So it inserts over here on the greater tuberosity. So when you bring your arm up and externally rotate, this bone comes up over here and the supraspinatus gets impinged, where it's being pinched by these two. So if you have a gigantic spur, there's very little room for this. So people come in and they can't move their arm anywhere near that direction because there's a mechanical block due to this spurring. And this is a great dramatic illustration of a huge one. So this is the MRI showing the supraspinatus tendon. So if you bring your arm up and it keeps getting pinched or impinged, you have impingement syndrome. And then if it chronically, the supraspinatus gets worn and beat up, it becomes frayed, you get tendinosis, which is scarring of the tendon, and then fibers can tear and you have rotator cuff tear or supraspinatus tear. If there's a complete tear, there's no pulley and it can't bring the arm up. Most of the time we see partial tears or just tendinosis. So this is a really good illustration of some of the things that go on. So you can see arthritis, you can see spurs, you can see on an MRI the actual tendons. And so some of the classic things we see in tennis players, by listening to them, examining them very closely, and looking at the diagnostic imaging studies, you can usually come up with a good diagnosis and then a treatment recommendation. And in our case, we're trying to use regenerative medicine and stem cell treatment techniques to help improve them. But it's important to know actually what you're dealing with, and then with good tennis players, you have to have a program set up around them so they don't keep making it worse while you're trying to get them better. So understanding this is very important, and the tennis players thank you when you can get them better.